Medications for COVID-19. Other names: 2019 novel coronavirus, 2019 nCoV, coronavirus, novel coronavirus pneumonia, SARS-CoV-2 infection. COVID-19 is affecting communities all over the world. You can learn more about the COVID-19 outbreak in other countries at World Health Organization. What is COVID-19? COVID-19 is the disease caused by an infection of the SARS-CoV-2 virus, first identified in the city of Wuhan, in China's Hubei province in December 2019. COVID-19 was previously known as 2019 novel coronavirus 2019 nCoV respiratory disease before the World Health Organization (WHO) declared the official name as COVID-19 in February 2020. The SARS-CoV-2 virus belongs to the family of viruses called coronaviruses, which also includes the viruses that cause the common cold, and the viruses that cause more serious infections such as severe acute respiratory syndrome (SARS), which was caused by SARS-CoV in 2002, and Middle East respiratory syndrome (MERS), which was caused by MERS-CoV in 2012. Like the other coronaviruses, the SARS-CoV-2 virus primarily causes respiratory tract infections, and the severity of the COVID-19 disease can range from mild to fatal. Serious illness from the infection is caused by the onset of pneumonia and acute respiratory distress syndrome (ARDS). Symptoms. The most common symptoms of COVID-19 include dry cough, fever, and shortness of breath. It is thought that symptoms can appear between 2 to 14 days after exposure, although there have been isolated cases which suggest this may be longer. If you develop symptoms, you should stay at home to prevent the spread of the disease into the community. Wearing a face mask will help prevent the spread of the disease to others. Update, March 10, 2020. According to the latest research published in the Annals of Internal Medicine, March 10, 2020, the median incubation period is estimated to be 5 days, and almost all, approximately 98%, patients who have been infected will develop symptoms within 12 days. Transmission. The SARS-CoV-2 virus is thought to spread from person to person via droplet transmission, large respiratory droplets that people sneeze, cough or drip; aerosol transmission, when someone coughs or sneezes in the room; contact transmission, touching a contaminated surface then touching your mouth, nose or eyes; direct transmission, kissing, shaking hands, etc. Prevention. The best way to prevent infection is to avoid exposure to the virus. The most important way to prevent COVID-19 is to wash your hands. Wash your hands regularly and thoroughly with soap and water, lather for 20 seconds, or use an alcohol-based, at least 60%, hand sanitizer. Other actions that help to prevent the spread of COVID-19: avoid contact with others who are sick. Avoid touching your mouth, nose, eyes or face. Cover coughs and sneezes into a tissue or into your elbow. Clean and disinfect surfaces. Alcohol or bleach-based cleaning solutions work best for coronaviruses. Face masks will not protect you from COVID-19, but will help prevent the spread of the disease to others. Social distancing, 3 feet between yourself and someone who is coughing or sneezing. What does self-isolation mean? Self-isolation means staying away from situations where you could infect other people. This means any situation where you may come in close contact with others, face-to-face contact closer than 3 feet for more than 15 minutes, such as social gatherings, work, school, child care, preschool centers, university and other education providers, faith-based gatherings, aged care and health care facilities, prisons, sports gatherings, restaurants and all public gatherings. You should not share dishes, drinking glasses, cups, eating utensils, towels, pillows or other items with other people in your home. After using these items, you should wash them thoroughly with soap and water, place them in the dishwasher for cleaning or wash them in your washing machine. Risk factors. Scientists are still researching risk factors for COVID-19, but data from China's CDC suggest that the elderly, and people suffering from pre-existing medical conditions such as heart disease, respiratory disease, or diabetes, have a higher risk of dying from the disease. There is research that suggests that smokers may be more susceptible to the SARS-CoV-2 virus. There is also evidence to suggest that people who use e-cigarettes, vaping, are at much higher risk of developing serious respiratory infections. Currently, there are no FDA-approved treatments for COVID-19. Several pharmaceutical companies and research organizations worldwide are involved in the development of potential vaccines. mRNA-1273, a novel coronavirus vaccine called mRNA-1273 Moderna, Inc., has been shipped to the National Institute of Allergy and Infectious Diseases ready for use in a Phase 1 study. Tonix Pharmaceuticals Holding Corp. has announced it is researching the development of a potential vaccine against COVID-19 using its proprietary horsepox virus platform. Researchers in Israel are working to adapt a vaccine that is effective against avian coronavirus infectious bronchitis virus (IBV) to work as a vaccine against COVID-19 in humans. Remdesivir, an investigational antiviral drug called remdesivir, is being studied in clinical trials in China and Nebraska, USA. Lopinavir and ritonavir, a drug combination called lopinavir-ritonavir approved to treat HIV under the brand name Calatra, is being studied in combination with the flu drug OSELTAMIVIR Tamiflu in Thailand. It was reported on February 18, 2020 that an elderly Chinese woman, the first patient to receive the Thai cocktail in Bangkok's Rojvithi Hospital, had made a complete recovery after suffering from severe COVID-19-related pneumonia. Favipiravir, an antiviral drug called favipiravir, which was reported February 17, 2020 to have received marketing approval in China for the treatment of influenza, was also approved for use in clinical trials as a treatment for novel coronavirus pneumonia. Fingolimod, an approved drug called fingolimod, marketed under the brand name Gilenya for the treatment of relapsing forms of multiple sclerosis, is being studied as a treatment for COVID-19 at the first affiliated hospital of Fujian Medical University in Fuzhou, China. Methylprednisolone, a widely used glucocorticoid called methylprednisolone, is being studied for safety and effectiveness in the treatment of novel coronavirus pneumonia in a number of hospitals in the Hubei province of China. Chloroquine phosphate, the older anti-malaria drug chloroquine, has been shown to have a wide range of antiviral effects, including anti-coronavirus. Studies in Guangdong province in China suggest that chloroquine may help improve patient outcomes in people with novel coronavirus pneumonia. Bevacizumab, a VEGF inhibitor called bevacizumab, marketed under the brand name Avastin for certain types of cancer, being studied as a treatment for acute lung injury (ALI) and acute respiratory distress syndrome (ARDS) in critically ill patients with COVID-19 pneumonia at the Qilu Hospital of Shandong University in Jinan, China.